hospitals, physician practices as well. This is what you need. This is Hilite Health. There's a problem in the system we cannot ignore. Out-of-pocket expenses for the patients has really soared.
Welcome to Hilite on Healthcare, sponsored by Empowered Home and by Hilite Health. In this episode, Bryan Graven talks with Walt Pistor, CEO of Empowered Home, about digital transformation in healthcare and the state of the healthcare market today.
Hello, everyone. I'm Bryan Graven. I'm the CEO of Hilite Health. And what we are doing here is we're starting a podcast that will really represent the different views and different topics all throughout healthcare. And with me today is Walt Pistor, the CEO of Empowered Home. And what I wanted to do with today's podcast is introduce Empowered Home and get to understand and know a little bit more about this company and how they're benefiting the medical community. Walt, welcome.
Thank you. It's nice to be here.
Thank you. All right, so let's just kind of jump right into it, Walt. How is Empowered Home really transforming digital tech right now?
Yeah, it's a great question. It's a broad question, but I think it's very relevant here. I've been in the healthcare arena now, enterprise IT, for 22 years, and so I've seen quite a bit. Starting off, digital technology's pretty much been transforming healthcare for over a decade, starting in 2009. And then through 2018, we might all remember this term called meaningful use.
I
gave us the platform to manage the exchange of digitized healthcare information. I mean, no longer were a patient's health record stuck in a manila folder in the physician's staff's filing cabinet, which was pretty much the case. Because we all know that in order for healthcare to be effective, we have to have collaboration. Then came the advent of, that forced the advent of electronic medical record systems, EMRs, which emerged to help manage and exchange all of that information and make it meaningful because healthcare relies on that. So then in 2015, which doesn't seem like that too long ago, we had the advent of telemedicine, which made it easier for doctors and nurses and patients to all collaborate with each other. And then shortly thereafter came telehealth, which was making patient engagement with remote non-clinical services easier. So, and now patients, could have conversations with doctors and their staff without having to come into the doctor's office. And so, one company that most of us know well is Teladoc, which is a multinational telemedicine and virtual healthcare company. So pretty much consumers quickly realized that they could get more responsive service with equal or better results for the majority of the minor health issues.
Sure. So with that whole evolution of going from paper charts to digital charts to standardizing really how healthcare practitioners practice medicine and document really a patient's chart, now we're at telehealth and beyond. So how is Empowered Home really putting all those puzzle pieces together, and really what are you offering out to the medical community now?
Yeah, well, I first like to there's one little aspect that I wanted to touch on first, Bryan, which kind of leads us to the answer of your question, which was COVID. So, COVID was like akin to the baseball bat, forcing the public to realize that the old way of doing things isn't the best way of doing things.
Sure.
And while COVID was highly disruptive, the silver lining in it all was increased public awareness and adoption of virtual patient engagement to a whole new level. And that's honestly, what has driven Empowered Home to come up with what they have. So there were some other critical factors behind that. So CMS, Center for Medicaid Services, was there to push the wave of transitioning providers to value-based care. People don't like change. They typically change when they have to and they feel enough discomfort. So most of us have heard of, anyways, so the CMS came out with, this increased remote care reimbursement codes and programs. So doctors first needed to know, hey, can I get reimbursed? Most of us have heard of RPM, remote patient monitoring. And now we have the introduction of RTM, remote therapeutic monitoring. And, I tell you, with the healthcare staff burnout from COVID, nurses are now lining up to practice virtual care medicine. And, what we do is they're using the advanced systems such as Empowered Homes. What we have is called a virtual care management platform, which combines telemedicine, telehealth, and remote patient monitoring with AI to be able to capture patient information and diagnoses from the records in multiple places, create an automated care plan, assess the patient's mental and behavioral health, disposition, and assign resources that are geographically close within their network.
Wow, that's
So,
impressive.
because what we realize, there's a lot of tech involved, of course. The biggest challenge in adoption of remote care has been patient compliance and patient adherence. So we spent about almost a year studying the market and looking at the adoption rates of the traditional RPM platforms. And what we came to realize was that the adherence, patient adherence for those platforms was only 30 to 90 days. So the kit would go out. The doctor would be like, well, I've checked the box, and the patient would stop doing it, and the kit would come back.
Yeah.
So, what we realized is that, the two items, Empowered Home is focused on these two items, right? So the patient compliance and patient adherence. That's really what we need to fix here in the current system. And they're really it all starts with behavior. And habits are built on repetitive behavior. So we're leveraging the consumer shift to digital engagement because the consumers want it and are demanding it. So they want an easy button. Everybody's squeezed for time. Customers don't want to sit on hold, talking to an office staff member, asking them about how to understand their bill. And they want the facts in an easy to consume single source of truth before calling. So what we have done is pulled together four primary partners in different areas. Privis Health, which is our clinical decision support platform; Edifex, which is helping us with using AI to automate the prior authorization process, which is a big challenge now. Nobi out of Belgium, which has an AI-based lamp that can capture behavioral information 24/7 while maintaining patient privacy. And really, one of the more practical partners is Hilite MD, who has made it easy for people to actually understand their patient bill, their responsibility, and then of course pay the thing instead of being lost in a bunch of EOBs and insurance statements and finally just letting that stuff sit there and never paying their bill. So it's impacting what we realize is that these physician groups, it's challenging enough moving to value-based care, but it's even more challenging when the revenue's not coming in.
That's
for
right.
patient collectibles.
Yeah, I definitely relate to that. And being the CEO of Hilite, we certainly understand the challenges on the revenue side. And just to kind of comment on what you said about COVID, I've heard from others that COVID really catapulted healthcare into a new era, right? And this new era is tech-enabled healthcare.
Yes,
so everything you're talking about with delivery challenges, with remote patient monitoring, being able to do therapy virtually, that's all really impressive and really relevant for today's healthcare practitioner. And I think you're right. Patients are looking for this level of care. And if you look at really the trends in the industry right now, those companies who are in that area, in that space, they're excelling right now because that is what the patient consumer is demanding of healthcare. and that's how they want their healthcare.
Yes.
So any final comments or thoughts on really the tech enablement of healthcare and how we got to this point post COVID?
Yeah, I mean, if you look at market acceptance, around the patient collections piece, I think a good example is, if you look at solutions like Hilite MD, they have seen through the offering of this technology. Some of us have seen it. We're all used to paying our bills online now. And now, of course, we just want to do it by clicking a link and on our cell phone, right? So what they've seen so far is, patient collections have increased by 25%, and staff and the consumption of staff resources has decreased by 50%. So, why is that really important? Well, I mean, we're under a staffing shortage right now.
Sure.
That matters. And the other big thing that I think all physicians can relate to is leakage.
Oh,
right? So people have
absolutely.
options today, and if customers aren't getting the information and the service in an easy to consume way, the way they want it, they just go elsewhere.
Yeah, absolutely.
And so I think this is where technology makes a big difference, because it you have to understand, like, where is my patient's head at, right? Are they happy? Are they getting what they need? So that comes back to, not only tools, but surveys and making it easy for them. And Hilite does a lot of these things. So we feel like it's one of these fundamental pieces of technology that really should just be a part of every physician practice.
Yeah, I couldn't agree more. When I think of really the consumerism of healthcare, I also think about it from the healthcare provider side. So if the bills aren't being paid, if healthcare providers aren't collecting the money for the services that they're delivering, well, that also puts a barrier to implementing new technology and paying for that new technology
Yeah.
that's being rolled out.
Yeah,
So all real important elements of healthcare right now. You can't really do a lot if you don't have money coming in the door, and at the same time, you have to engage the patient differently on the financial side, which is certainly what Hilite is doing. All right, that's great. So we're talking, and you and I both agree that these solutions are needed. What are you seeing right now from a marketplace? Are healthcare providers embracing this technology? Where's the market acceptance right now?
Well, I think if one of the key indicators is looking at mergers and acquisitions. And, from what we've seen, there's been a tremendous activity in M&A for home care agencies.
Oh, I've seen that. Absolutely.
Now, why is that? Well, because the home care agency has their finger on the pulse is what's going on. Remember, I was talking about behavior. So, a doctor may just have a little snippet, but what goes on the rest of the time with that patient? So what we're doing is actually, giving, through the use of AI and technology, we are giving the patients, as well as the supporting providers, and that can be office staff and whatnot, superpowers. Because this is where AI excels, is when it provides the information and does all the donkey work, and puts that information at people's fingertips so that they can provide more value to that patient. They're in tune. You're only as good as the information that you have. And I think this is also, again, where, when you look at the basic things like patient collections, right? Imagine just now being able, as a consumer on your phone, being able to just easily look at, understand your bill, because that's typically why people don't pay the thing, is because they don't understand their portion of it. And now the amount of time that they have to spend on this is reduced down, and it gives them options, right? So if you have elective surgery, and maybe it's expensive, sometimes those things can be $20,000, $30,000.
Yeah. Oh,
Why
wow.
not be able to assess what my portion is going to be, and then, gosh, if I need to finance it, I've got options too.
Yeah, absolutely. So, and it's kind of takes me back to just walking into a clinic or a doctor's office. Typically, when you walk into the office and you go to the reception area to check in, you have people in the back office who are so busy. They're multitasking. They're picking up faxes off the fax machine. They're trying to check in, check out patients. They're answering the phone. They're trying to get to emails. There's just so much going on,
Yeah.
and the more we can automate, the better I think the patient experience is. So when that patient walks through the door, they're really the superstar, and you have that customer patient experience that we see in other industries, right? And that's what we're trying to do and deliver it to healthcare. So I think that's huge and very valuable to everything that we're talking about here. So I can certainly see how the portfolio of solution providers is tremendous, and what you're providing offers a lot of value out to the medical community. I think it's amazing. So what do you think the future is? And I'm going to take it a step further. If a healthcare provider or a hospital wants to engage Empowered Home and learn more about your services, what would they be able to do, and how would they be able to get in touch?
Yeah, we have a website that you can go to, info@empoweredhome.com. And I think, one of the key things, if you reach out to us, we take this more of a consultative approach, rather than kind of a single refined product that needs to fit a need. We have kind of a toolkit of products, and some very knowledgeable, experienced staff in order to be able to understand what the challenges are for that independent physician association, physician group, hospital, and what kind of programs they have in place, what kind of systems do they have in place, what are their pain points and challenges, and how do we layer in the right solutions to help get them past their pain points, but not throw away the work that they've done thus far, right? So I think it just makes a lot more sense to leverage the momentum that somebody has achieved and then augment that. That's generally what people are looking for. And so that can range, again, across those 4 area partners, so that we can actually, in all distinct different areas, so that we can grab technology and merge them in order to be able to solve the challenges as the physician groups are, move over to this migration to value-based care. And so, again, I think just at a very fundamental level, the patient collections is a big part of things. And so it dovetails well with also other things like, how does the doctor, it can be something as simple as like, how does the doctor summarize their notes to the patient? Well, the patient, it's probably about 10-minute interview process between the doctor asking the patient questions, he's looking at the chart, the patient's answering, he's adding more information. Now that the doctor's made an assessment, how does that assessment now get relayed to the patient today? Well, not very well. Yeah. So, but there's a great little tool that Hilite offers, Hilite MD offers, that allows a safe HIPAA compliant platform, and the doctor can just summarize what the treatment plan is for the patient, along with the prescriptions and whatnot, and a nice little video link for the patient, so they can always go back. And now you don't have the breakdown in communication or the patient's trying to remember what they were supposed to do.
Yeah, I've always been a huge fan of the power of video, but video messaging definitely takes that patient engagement to the next level, and certainly is a powerful asset within the Hilite MD platform. Well, we're kind of wrapping up here. Any final words, any thoughts before we close?
I just think that we're on the cusp of a very exciting revolution in healthcare. And so being in the business for 22 years, I'm pretty excited. I've been, heavily studying this field of digital health transformation, is, really focused in on it since 2015. And I think right now, because of COVID and because of where AI is and technology, I just want to assure that things are going to get better for everybody, for the patient and for the provider too, for the nurses, you know, less burnout.
Mm.
You know, everybody's happier. It all really comes down to communication, and I think this is where the AI is going to help out quite a bit. And I know that you know, Hilite leverages some really cool technology like robotic process automation. You know, I think what's going to happen here in the near future is that people are going to have their and it's already happening, right? They're going to be having all their systems monitored, right? They're critical things that they need to be monitored for, and their behavior and their implementation. Then you can see how their health is improving or not improving. And then it's a closed loop feedback system where modifications can now be made and to improve that healthcare plan until they get the health trend moving in the direction that it was the goal of the care plan, right? And that starts with here and here, right? It's a yin and yang combination, and you know, I think this is where the technology is going to ultimately improve healthcare for the better and reduce the expense.
Yeah, I couldn't agree more. I think, and just to you know, summarize, it's really that tech enablement that's showing results, showing, you know, return on investment.
Yes.
And that's what an Empowered Home is all about. It's really bringing together all those pieces of the puzzle to create that value proposition to the medical community, which is truly impressive, and one of the reasons why we wanted to partner with Empowered Home.
Well, thank you, Bryan.
So, Walt, it was a honor, a pleasure being able to interview you. Look forward to our next episode. Thank you.
Yeah, humanizing the patient-doctor experience.
Awesome. All right.
All right.
Thank you.
Hospitals, physician practices as well. This is what you need. This is Hilite Health. There's a problem in the system we cannot ignore. Out-of-pocket expenses for the patients has really soared, and they can't